Hi, I'm Dr. Harch, and I want to talk about hyperbaric oxygen for coronavirus and the double standard in medicine that seems to be preventing people from using hyperbaric oxygen for this diagnosis. It can be characterized by uncontrolled, randomized, prospective, double-blinded blindedness, a term I borrowed from Dr. James. Well, I'm going to make a statement here at the start. Hyperbaric oxygen is evidence-based medicine for coronavirus 19 respiratory failure. And if that's true, why is it not being used? And the reason is there's a double standard in medicine and arbitrary decision making. And I want you to follow this argument. It's the reason why really a patient cannot get any medical therapy in the United States unless it's backed by big money interests. What's the practice of medicine? Well, it's finding treatment to relieve pain and suffering, and once in a while finding a cure. It's what every doctor does every day in their practice. Does that sound familiar? Of course it does. That's the Hippocratic Oath. I will prescribe regimen for my patient while doing no harm. Of course, that raises some questions about ventilator use in coronavirus infection. The Hippocratic Oath has been the standard of care in medicine since even before the Hippocratic Oath, and it still is. It's what doctors have been doing since the dawn of the healing arts, or at least until the advent of the FDA, where now the practice of medicine in the United States has been misdefined as the practice of medicine with exclusively FDA-approved drugs and devices. And it kind of begs the question, well, what's the purpose of the FDA and how did this happen? Well, the FDA came about to protect the public from medical harm by preventing false claims from drug and device manufacturers. And they do this by labeling a drug or device. So what's the FDA label? It's the statement attached to the drug or device by the FDA that identifies what it's been, quote, proven to benefit, according to the level of scientific evidence required by the FDA for proving, which is randomized controlled trials. Or at least it used to be. Things may have changed a little with the Cures Act now, but this label is commonly referred to as the FDA approval. Well, the FDA label is what a drug or device manufacturer can advertise their drug or device for, but it doesn't apply to a doctor's individual practice of medicine. According to the FDA, they don't regulate the practice of medicine. They made this statement, it's on their website, I've even been told that. Well, what's happened though in the United States is that the words FDA approved have been corrupted to apply to the practice of medicine and the Hippocratic Oath. There's now a presumption that a doctor can't use a drug or device according to the Hippocratic Oath unless it's, quote, FDA approved for that diagnosis, and it's just false. But that false presumption's been further corrupted by the academic medical community in the dictum, no treatment should be rendered to a patient unless it's proven with randomized controlled trials. Well, the reality is, if that were true, we wouldn't be able to practice medicine because it's commonly known that roughly 75 to 80% of the practice of medicine is not supported by science. It's habit, history, opinion, just practice that's grown up over time. But this false presumption's been additionally corrupted to label any treatment not, quote, proven by randomized trials as experimental. And the doctor who is using that treatment for that diagnosis is experimenting on his patients, which is false. But the final step in the corruption of this practice of medicine is equating randomized trials with evidence-based medicine, a term that everybody is familiar with. Well, what is evidence-based medicine? If you go look at the definition of it, according to Dr. Sackett, it's the use of best medical evidence, meaning scientific studies, combined with the physician's experience and the patient's preference to deliver the best medical care. Well, that's not randomized trials. And this concept of evidence-based medicine has been corrupted to where now evidence-based medicine's been characterized as uncontrolled, randomized, prospective, double-blinded blindedness. It's using this randomized controlled idea to disparage anything that is not a randomized controlled trial. So what is evidence-based medicine? It's the use of an FDA-approved drug or device, the best scientific reasoning on the use of that drug or device, combined with other physicians and the treating physician's experience and the patient's preference after informed consent to treat that patient. But it kind of begs the question and makes us look at what the FDA approving process is and how we got here. Well, the FDA approval process starts with single case off-label treatment of a drug or device by a doctor to treat his patient according to the Hippocratic Oath. And if that treatment is successful, Well, he treats another one of his patients that way, and eventually he generates a case series. He might publish it, or other doctors might hear about it. And they try it on one of their patients, and if it's successful, they generate a case series. Eventually, case series get published, and finally, these ideas make it to the university setting where the platform is there to be able to do studies and get funding for the studies. And then a randomized trial gets done at the university, and the doctors stand up and say, look what we discovered. But it all began with individual cases and case experience according to the Hippocratic Oath. Which leads me to hyperbaric oxygen for COVID-19. And the double standard in medicine is now being applied here. Based on the application of hyperbaric oxygen, dying Spanish flu victims by Dr. Cunningham in 1918, blunt chest trauma patients who were treated for the acute respiratory distress syndrome by Dr. Rogotsky, the identical condition that coronavirus patients are dying of, and now to coronavirus patients in China as well as the United States, hyperbaric oxygen is evidence-based medicine for COVID-19 infection. But where do we find evidence-based medicine in an identical argument for HBOT and another diagnosis? It's in the HBOT accepted indication of acute severe blood loss anemia. What is acute severe blood loss anemia? It's massive blood loss from your intestines or into your chest or from a wound or trauma, a crush injury that leads to insufficient oxygen in your blood because you don't have enough blood cells to carry the oxygen. So you have systemic hypoxemia. Well, hyperbaric oxygen is approved to be administered to reverse that hypoxemia and to correct some of the oxygen debt before you can get a blood transfusion in the patient. But each hyperbaric treatment only causes a transient rise in blood oxygen that dissipates after the HBOT. There's no permanent effect there, except maybe some effect on the oxygen debt reversal. So it has to be given continuously or repetitively closely enough to keep patients' blood level of oxygen up until their bone marrow makes enough new blood, or you can get them a blood transfusion. But there are no randomized trials to support the use of hyperbaric oxygen in acute severe blood loss anemia. So what does hyperbaric oxygen do in COVID-19 infection and respiratory failure? Patients are dying of hypoxemia, and it's due to the inability of oxygen to penetrate the fluid and the thickened interstitium in the lungs to get to the blood vessels and for the oxygen to attach to hemoglobin in the blood that's passing by. The only way you can do that is to rise above atmospheric pressure with the pressure of oxygen to penetrate that in the lungs. The beauty of it is, though, it doesn't just have a transient effect while you're oxygenating the patient in the hyperbaric chamber. There's a permanent effect on the underlying lung pathology that accumulates each day, according to the evidence. So essentially what we have is one diagnosis with no randomized trials to support it, which is reimbursed by insurance companies, and another diagnosis supported by the same scientific argument that is really evidence-based medicine, but it's called experimental for COVID-19. Well, this is the definition of a double standard. It's arbitrary reasoning. And I'd ask you, using the same reasoning, why is hydroxychloroquine not called experimental? Or ventilator use for COVID-19? Show me a randomized trial of a ventilator use in COVID-19 patients. There are none. So what's the argument against applying hyperbaric oxygen to COVID-19 patients? When the science supports it, it's been previously successful in a similar virus infection of the lungs, i.e. Spanish flu. There's successful case experience now both in China and the United States. It's an accepted reimbursed therapy for a condition that causes death by the same phenomena in COVID-19, hypoxemia. It's safe. It's available at nearly 25% of the hospitals in the United States, and it's also the practice of medicine according to the Hippocratic Oath. What's the argument? Well, there is none. There is no argument against it. In fact, HBOT may be evidence-based medicine for COVID-19, hypoxemia, pneumonia, and respiratory failure. Thank you.